Good afternoon. My name is George Reyes. I'm going to do the final presentation for a patient in the class NU Advanced Assessments 650. Here with us is Anna, who is going to help us. And I'm going to ask you a question. Anna, are you agree to do the video with me?
Yes.
Okay. So let's start with the evaluation. The first thing to do is I'm going to wash my hands. Okay, let's start with the evaluation. The first thing, we're going to check the skin. So we're going to see if the skin has any kind of lesions, atrophies, has any kind of lesion, dots, any kind of cuts, any kind of scars. And we're supposed to check the whole entire body for scars, especially in the abdomen, to see if she has any surgery scars in the legs. After we check the skin, we're going to check the head. We're going to see the distribution of the hair, if there is any baldness areas, bald areas in the scalp. Then we're going to check for any kind of injuries, the consistency of the hair, the distribution of the hair all around the scalp. Then we're going to see the face. We're going to see symmetries of the face. We're going to check it out if she has any kind of deformations, any kind of tics, fasciculations, especially in the ear or in the cheeks. We're going to see if she has any kind of masses or bumps or exudations. Then we're going to check the cranial nerves. For do that, we're going to start with the trigeminal nerve, which is the fifth. In order to do that, I'm going to take we're going to see the sensitivity of the face. So Anna, did you feel something?
Yes.
And then to the other side. You feel something, Anna?
Yes.
Okay. Then we're going to see for pain. So we're going to use a piece of wood to see if she has any. You feel the pinch?
Yes.
What about this one?
Yes.
You feel the pinch?
Yes.
Okay. Especially it's in three areas because it's that terminal nerve that we are checking out. Then we're going to see the also for the fascia, we're going to ask Anna to clench your teeth, to open your mouth, and to move your jaw to both sides. Okay, we see the symmetry, we see she's able to do it. Okay, Anna, thank you. Then we're going to check the fascial nerve, which is the seventh. We're going to ask Anna to close her eyes as tight as she can. We're trying to open her eyes. We're going to ask Anna to fold your head, okay, to smile, okay, to puff out air from the cheeks, okay, and also we're going to see then the maxillomandibular joint. So open your mouth, close it, open, close, open, close. So we see if she is able to open, we're going to see, can you move to the sides, your mandibular? Okay, thank you. Now we're going to start to, the other thing is that you're very up your, okay. Now we're going to check the eyes. We're going to see the shape of the eyes, the color of the eyes. Keep your eyes open. We're going to see if she has any kind of bleeding or infection in the eyes. You can see the sclera, the color of the sclera. Now we're going to check the movements of the eye. So please look my finger, go to the sides, both sides, go to the sides, go to up. So if we put the finger in this area, we're checking the 6. We put the finger in this area, we're checking the 4th. And then the rest of the eye movements are for the third nerve, cranial nerve. Okay, now we're going to use the otoscope. So we're going to check the pupils. So let's assume that this is a dark room, because we have to have a dark room. I'm going to ask Anna to open the eyes. Look at that. Open your eyes. Look the light. Look the eye. I'm trying to check if the pupils opens and close both at the same time. Oh, look at the light. Okay. Then we're going to check for the vision of Anna. So let's assume that we have the Stelling card in front of you. I'm going to ask you to put your hand in front of your right eye, but keep the eye open. Just cover your eye. And then, can you read the lines? As soon as you are reading the lines, the numbers. So say any number.
A1.
Okay. Now the next line.
S6.
The next line.
LV.
Okay. Now we're going to do the same thing with the other eye. So the first line.
S.
Okay.
X.
The second line.
6IY.
Okay. The second line.
ZLK.
Okay. So now we have a exam of acuity of the vision. Now we're going to check the inner eye. So let's assume that the room is dark. What I'm going to do is I'm going to check the eye. I'm going to see if the pupils respond to the light. Then I'm going to check the eye, looking for the arteries and the veins, and also see if there is any pigmentation inside the eye. And then any spot that caught my attention in the retina. If I don't see anything, I will try to follow one of the arteries and go to the fovea. Now I'm going to do the same thing for the other eye. So I'm going to check the other eye, trying to see, look in front of you to the point over there. Okay, don't look at me. So we're trying to see if I can see the fundus, I can see the arteries, I can see the veins. I check the fundus of the retina, and then try to follow one of the arteries to see the fovea. The last thing I'm going to check with the eyes, I'm going to assume that the room is dark. So I'm going to put a light like maybe 18 inches from her, and look the light. And the idea is to see if we can see the red reflex that it will give you some kind of pathology. After the eyes, we're going to check the ears. So in order to check the ears, I'm going to look for the helix and anti-helix to see if she has any kind of lesions. We're going to see the surrounding areas. We're going to check for any pain. The same thing with the eye, the second eye. The ear, we see the helix and anti-helix, and to see if there is any kind of mass, any kind of lesions in that area. And then we're going to see the mirror ear. To check the mirror ear, we're going to use the otoscope. And we are going to ask Anna to look to the side. We're going to pull up and back. to see the canal, we are going to see if there is any wax, if there's any foreign body, if there is any lacerations or exudations. We are trying to see at the very back the membrane tympanus that you are going to see with a little light that is reflects from the very back. Once we see that, we can go to the next year, where we are going to see the same thing. Please, Anna, turn around. Let me check it out. I'm going to pull up. So we do the same thing that we did with the other ear. Trying to see wax, erosions, trying to see any foreign bodies. Then we can see the membrane tympanic at the very back. Now we are going to see the nose. In order to see the nose, first of all, we are going to see if it has any kind of desviations. We're going to check for the sinuses, the frontal, the parietal sinuses, see if there is any obstruction, if there is any congestions. Then we're going to use one of the teeth so we can see inside the nose. We're going to see if she has any kind of erosions, any kind of obstructions, polyps, bleeding, and see that if the nostril is without any obstructions. Then we're going to check the mouth. In order to check the mouth, we are going to use our depressor. So open your mouth. We will see the gums. We see all the gums around the gums, if there is any kind of erosions. Then we see the color of the teeth, if there is any decoloration. We can see the parotid. We see the teeth, if there is any kind of caries or any problems with the teeth. Then we see the hard palate and the soft palate. Anna, can you protrude your tongue? Protrude your tongue, move up and down. Then we are checking the 12 part cranial. Then we're going to see the uvula. So put your tongue out, going to depress it. We're going to see the uvula. We're going to ask you to say ah. Okay, we're going to create a gag reflex. Okay. Good. Create the gag reflex. Then we're going to check open your mouth. We're going to see the tonsils. We're going to see the pillars. If there is any kind of inflammation or any kind of problems in the back. The last thing that we can do is we're going to ask her to swallow. So we can feel that she is swallowing, and then we can see if there is any mass or nodule around the area when she is swallowing. Okay, now we're going to check the neck. In order to check the neck, we're going to ask Anna to touch your chest with your chin. Go all the way back to check the ceiling. Okay, now straight. So over your shoulder to the other side. Now go to the sides. Okay, we are checking the mobility of the neck. Now we're going to check it for ganglions. We will start with the occipital, postauricular, preauricular, submentorians, the superficial and deep cervical ganglia from both sides. The supraclavicular ganglia. Okay, and the last thing we're going to see if there is any mass or if there is any nodule in the tracheal area. We try to see the thyroid gland from both sides. We'll see if there is any pain. Then we can see the muscle, the sternocleidomastoidal muscles. Okay. Now we're going to check the lungs and the heart. In order to do that, we're going to ask Anna to come a little more to the edge. Okay, we're going to check first the back. We're going to move her hair to the front. Then she's supposed to have a gown, but we don't have no gown. So let's assume that she has a gown. I'm going to ask her to open the gown. So to do that, like, I'm able to see the back of the area that I'm going to examine. I'm going to see for masses, for any kind of asymmetries, to see if she is able to breathe smoothly without any problems. They are going to ask her to say 99. Say 99.
99.
We're checking the frame tooth one more time.
99.
One more time.
99.
I'm going to ask her to take a deep breath so we can see how much she is able to expand the thorax one more time. Okay, thank you. Then we're going to percute the lungs. So maybe you can move a little bit. Move all your body so you will be able to see what I'm doing. I'm going to palpate, to percute. So we go both areas to see if there is any kind of mass. The last thing that we're going to do is to hear the lungs. So we ask Anna to take a deep breath. One more time. Take a deep breath. 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 Perfect. Okay, thank you. So now we're going to check the heart. In order to do that, we're going to ask Anna to lay down in the bed. The first thing that we're going to check is the carotid pulse. So we try to locate the carotid pulse, try to feel it, see if there is any bruise. Now in the other side. Also, we are going to check once the brachial pulse, the radial pulse. We're going to check the popliteal pulse that is down here. The tibial posterior pulse and the pedial pulse. I'm going to do all of this at once. So this is the popliteal. The femoral pulse, that is right here. Femoral pulse. Femoral pulse. Then the radial of the other hand. The brachia. The carotid pulse. Okay, now I'm going to listen to the chest. As I said, she has to have a cow, but we don't have it. So I'm going to assume, first, have a seat. We're going to see, let's say that this is open. So let's see, we're going to see if she is using her accessory muscles in order to breathe. This is part of the lungs examination. So we're going to see if she used the muscles and the intercostal muscle to breathe. Because she's not doing, now I'm going to check the heart. In order to do that, I'm going to hear, we're going to see if there is any problem with we're going to look for the PMI. The PMI is a line, it's a specific spot where you can see the pulse at the maximum speed of the chest. So in order to look for that specific spot, we're going to trace a line, mid-clavicular line, and we're going to look for the 6 to 7 intercostal space and we have to see the PMI. If we don't see it like that, we can ask to Anna to move to lane your left side a little bit, not that much. So in that way we can see if she has, we can see, we can identify the PMI. Once we located the PMI, we're going to check the valves. So we're going to check for the aortic, which is in the second right side. The pulmonary is in the second left side. The tricuspid is in the fourth left side. And the mitral, which is in the eighth left side to the side. If we cannot hear the mitral, we ask the patient to lean to the left. And then we go all the way with him. We try to locate the mitral area, putting our stethoscope over the left side. Okay, now we are going to check the abdominal area. In order to check the abdominal area, we're going to ask the patient to take away all the clothes. We're going to first inspect the area to see if there is any posture that she is adopted for any kind of pain that she might have. We're going to see if there is any bumps, if there is any something that call our attention that is not normal. Once we do the inspection, we're going to listen to the abdominal area. We're going to check for the aortic pulse, also for the renal arteries, the aortic artery, the renal arteries. We're going to check for the iliac arteries and for the femoral arteries, looking for any kind of bruise. Then we're going to check for bowel movements. So we go all the way to the colon area to check for the bowel movements. And then we're going to check, see if there is any bruise about the spleen, which is in the left side, or any bruise in the liver, which is in the right side. Once we do the auscultation, we're going to do the superficial, we're going to percussion to see if there is any mass, if there is any wave of liquid inside the. Also, we can detect the liver by percolating from the very up, from the very top area of the breast down to see if we can identify the edge of the liver and also the edge of the spleen. So we can do it, but do the percussion of those two areas. When we finish the abdominal area, can you sit? We're going to check for the upper superior extremities, for the upper extremities. We're going to start to check the hands. So in order to do that, I'm going to ask her to make a fist with both hands. Make a fist. Open your hands. Try to open your fingers like this. Okay. So, okay. Now grab my hands. Okay, to see the straight. Okay. Now lift your hand like this. And keep it. Now go down. Now the other one, lift it. Go down. All the way. Okay. Now move your hands like this to the sides. Okay. Just at the wrist. Okay. Okay. Now we're going to check the elbow. Flex your elbow. Go all the way like this. Extend the elbow. Now the other one. Do the same thing. Flexing, extension. Now go like this. So we're checking if she can do pronation and supination of the forearms. Now I want to ask you to stand up. Okay, and I'm going to ask you to stay at the size of the TV. Okay, now go all the way with your arm straight. Go all the way back. Go all the way back. Okay, now go all the way up. Okay, now try to touch your back. Now try to touch your arm, your shoulder. Now go like this. Okay, and like this. That's it. Go all the way back. Now go like this. Okay, so we are trying to now do the same thing with the other hand. First back, go all the way up, go like this. Now go like this, and up. Now go like this, and here. Okay, with that movement, we see the extension, flexion, abduction, adduction, and internal rotation and external rotation of both arms. How is it? Oh, now let's do the walking. Let's walk back and forward. When she's walking, we are seeing if she's using the toe heel to walk. We see the balancing of the arms, the position of the walking. Now walk with your toes to see the strength. Now stay in one side, stay there, and step up in your toes. Not bump, hop, hop. Okay, thank you. And now, how is it? We're going to check now the lower extremities. So, how is it? Okay, in order to check the extremities, first we're going to see the hip. So we are going to ask Anna to touch with her chest with her knee. Okay, not the other leg. Okay, now with your knee, with your hip bending, try to touch your leg with the knee. Now to the other side. Now do that with the other leg. Okay. Now how is it? Lift your foot. Lift the foot. Your foot. Go all the way. Now bending. Now lift your other foot. Bending. Now rotate your foot like this. Okay, now the other one. Okay. Now lift my hands. Now the opposite. Okay. Now pull up my legs, my hands. Now the opposite way. Okay. Now go to the bed. Bring my hands up. Now the opposite way. Okay. Now move your feet to the side. Now move the other feet. Okay, that's it. How was it? Now we're going to check the reflexes. Now to check the reflexes, we're going to check the first reflex will be the trachobrachial here. And the other one. And the other arm. Not here. Okay. Now let's see the reflex here. Okay. Now this one. And this one. Okay. Okay, the last, the other part is we're going to stand up. I want you to turn around. Okay, now close your eyes. And she's going to stay in that position for 30 seconds. If she moves and she cannot stay steady, that would be a positive scene. It's called rumbar. Then open your eyes. Now put your feet close together. Okay, lift your hands. Put your palms up, both of them, and then close your eyes. This is the pronator shift sign. The idea that if she has any problem, one of the arms is going to fall down. If both arms stay there for 30 up to 1 minute, means that it's negative. Okay, have a seat. Now we are going to check for hearing problems. This is the tuning fork. So let's say we put it here. And she has to listen to the vibration of the fork. Then I'm going to, can you move a little bit here? I'm going to whisper something in her ear to see if she can hear me. Can you repeat after me?
1, 2.
Okay, now the other side.
1, 2.
Okay. So once you whisper me that she is able to hear clearly what I say, now we're going to check the vibration area. So we use the fork, the tuning fork, putting the foot. And if she feels the vibration, means that it's positive, which is the normal thing. We go like this. We put it here in the foot. So if she feels the vibration of the tuning fork, means that she's okay. Then we're going to see if she's able to feel. Close your eyes and tell me where you feel. Where?
On my right. Right.
Right what?
Left forearm.
Okay.
Right arm. Left arm. Left neck. Right neck.
Okay. Now with the same thing, but with some kind of pain stimulus.
Right forearm. Left forearm. Right wrist.
Right.
Right wrist. Left cheek. Right cheek. Right forehead. Left foot. Right foot.
Okay, now we're going to see if she can feel the same thing, but with close your eyes. How many pitches do you feel?
2, 2, 1, 1, 1.
Okay. Now we're going to see if she can synchronize. Close your eyes. Open your hands. What is this?
Spoon.
What is this?
Pencil.
Okay. So now open your eyes. And tell me what number you feel that I'm going to write.
8.
Close your eyes.
Out. 3. 0. 9. 5. 5.
Okay.
8.
Okay, thank you. No sé cuánto llevamos. What else we have to check? ¿Qué tienes? Estamos grabando, mija.